So you've learned about cognitive behavioral therapy for insomnia, you're starting to apply sleep restriction therapy, and you're getting some benefits. You're noticing that most of the time you're spending in bed is actually for sleep, your sleep quality is improving. And then you have the question, well, at what point do I start not just focusing on quality, but also on quantity? How do I decide when it's time for me to start spending more time in bed? So this video is meant to address the question, when do we decide to engage in time in bed extension? How much time should we add? As well as, where should we put that extra time? Is it in the front end or in the back end? If you don't know me, hi, my name is Dr. Parky. I'm a Stanford trained behavioral sleep medicine specialist, and I've been providing evidence-based behavioral sleep medicine to patients with insomnia for many years now. I'm also the author of the self-help book, The Insomnia Paradox, which talks about CBT strategies and learning to become your own insomnia therapist. So today we're going to answer that specific question of time in bed extension. So as an insomnia therapist, there are really three main indicators that I use to decide whether or not it's time for a patient to start spending a bit more time in bed and engage in time in bed extension following the initial sleep restriction. So number one is time it takes a person to fall asleep. So typically when a person starts treatment, they notice that they have a hard time falling asleep. It might take them an hour, 2 hours, maybe more in order to be able to fall asleep. And a good sign of sleepiness that a person is starting to need some extra sleep is usually if they're starting to fall asleep in less than 10 minutes. So on average, a good sleeper usually takes between 10 to 30 minutes, and anything less than 10 minutes, we start to move into the realm of, hey, this person's actually a little bit too sleepy. Like if they were to fall asleep that quickly, does that mean that they might have a little bit of chronic sleep deprivation? Maybe we're restricting a little bit too much at this point, and they could benefit from a little bit of extra sleep. So alongside a low sleep onset latency, another indicator that it's time for extension is a high sleep efficiency. And what sleep efficiency really is that it's just the proportion of time you're spending sleeping relative to how much time you're spending in bed. So a person who is sleeping for 5 hours but spending 10 hours in bed would have a sleep efficiency of about 50%, whereas a person who is sleeping, let's say, 7 hours but spending 8 hours in bed would have a sleep efficiency of about 88%. And a good sleeper generally is somewhere between 80 to 90%, where if your sleep efficiency is over 90%, that's a good sign that you're ready, your body is ready for some extra sleep. Now, there's different norms. Some people say, over 85 is a reasonable time to, add a little bit of time to the schedule. I think it kind of really depends on you and how you're kind of feeling. It's certainly worthwhile to see what it'd be like to add a little bit of time, then see if your body can fill up that extra piece. But certainly 90% and above, that's a really good time to say, hey, my body needs a little extra sleep, time to add it. So the first indicator is a low sleep onset latency, and number two is a high sleep efficiency. Number three is evening dozing. So if subjectively you're noticing that in the evening especially, you're starting to kind of doze off, like you're almost getting these little micro sleeps, you feel a really strong need to sleep, then that's also a good indicator that you probably need some extra sleep that can be added towards the nighttime so you don't feel that way during the evening or during the daytime. So this is kind of more of a subjective sense of sleepiness, not fatigue in that like you need to rest, but like literally if you were to like give yourself in for a moment, you could actually fall asleep. That's another good indicator that you could use a little bit of extended time in bed. So in terms of how much you should add, I would say to take a pretty conservative approach. We don't want to ruin the great work that you're doing, and start by adding 15 minutes. Add 15 minutes, see how that feels for you. If it feels like your body can still really like consume all that sleep, you're still falling asleep pretty quickly, your sleep efficiency is still good, then add another 15 minutes after, let's say, about a week or so, and continue doing so until you're like, okay, like this feels really good to me. Like, I don't think I need any extra sleep. I don't feel any better with more time. This is the right time for me. That is when you'll know that you've finished your time in bed extension, and that is the proper quantity and quality of sleep for you. So another question that people often have is, well, where do I put that extra 15 minutes? Like in the front end or the back end? Like, should I go to bed earlier? Let's say my time in bed right now is 12 to 7. Should I go down to like 11:45 or should I go up to 7:15? Where do I put it? And the answer to that, I would first prioritize where you're most likely to be able to catch the extra sleep. So what I mean by that is, let's say you're getting really sleepy at 11:30, even though your bedtime is 12, then you would say, okay, like I could probably shift it to 11:45 because I'm likely to be able to sleep pretty well then. Or on the other hand, if you're like, well, I usually, wake up from the alarm at 7, but I feel like I could really use a little extra sleep, then you can totally add that 15 minutes to the back end. And certainly that also depends on your schedule. Like if you have to wake up at 7 no matter what because of work, then maybe it makes best sense to, put it at like 11:45. And if you happen to not be sleepy at 11:45, of course, you can just wait until your usual 12. We don't want to go to bed when we're not sleepy, but that can be a good way to identify whether it makes most sense to add 15 minutes to the front end or to the back end. So hopefully this video was helpful to help understand a little bit more about this idea of time in bed extension, when you can start applying it after the initial sleep restriction therapy, and then be able to get to the point where it makes best sense for you to have the best quality and quantity of sleep. Thanks for watching as always, and I'll see you in the next one. Bye-bye.